Hello, how are we doing out there? My name is Dr. Sophia Tolliver, and I am a clinical assistant professor in the Department of Family Medicine here at The Ohio State University Wexner Medical Center. Welcome to today's Facebook Live event. I'm broadcasting live from my home office. Thank you for joining us. Today's topic is about COVID-19 questions answered. We've assembled several questions from past Facebook Live events, questions that maybe you've been too hesitant to say or too scared to ask. We're going to answer those questions today. We're also going to give you a chance to type in the chat box. I think it's down there at the right. And we'll try to answer some of your questions at the end of the 15 minutes. We might not be able to answer all of your questions, but we're going to try and do our best. So let's get started. We're going to go through 12 commonly asked questions. Okay, question number 1. Does the number of times you're exposed to COVID-19 from different people increase your risk of having a more severe case of COVID-19? Now, in just trying to tease this question apart, I would offer that increased exposure to COVID-19 infected individuals increases your risk of getting the disease. The more frequently you are around infected individuals, the better your chance of getting the infection. You only need to be infected once to get any symptoms. Severity of infection depends on your health history, chronic diseases, immune system, and symptoms. Question number 2. Do I really need to disinfect high-touch surfaces every day if I'm just here with 1 or 2 other people and we only ever interact with each other? That's a good question. I would say that if we truly lived in a closed system in our homes, we didn't go anywhere, we only interacted with the people that we knew were asymptomatic, didn't have any symptoms, it would be very less likely that COVID-19 would spontaneously come into this system. But oftentimes, we're taking the trash out, we're going to the park still, we are going to the grocery store, we are picking up prescriptions, and so all of these different interactions can leave us at risk for contracting the virus. So yes, absolutely, I believe that wiping down those high-touch areas and surfaces is just another way to keep us protected from bringing the outside into our homes. Okay, question number 3. Can you have a severe case of COVID-19, even die of it, without feeling any symptoms? I would say that this is highly unlikely. Given the pure characteristics of the disease, we know the disease can cause symptoms, and it can cause severe symptoms like fevers, cough, shortness of breath. And so for someone without any symptoms to spontaneously pass away, very unlikely. But if you are a healthy individual without any chronic disease or health issues, is it still possible for you to get the disease and potentially severe symptoms? Yes. So it's very important that we are all taking precautions to help decrease the transmission of COVID-19. Okay, question number 4. Is there a way to tell if your breathing difficulty is related to COVID-19 versus something else like allergies or anxiety? And also, what does a dry cough really feel like? Good question. So shortness of breath or difficulty breathing can certainly be related to a lot of different illnesses or conditions. For example, asthma, COPD, anxiety even. So when trying to decide if these symptoms are due to one of those versus COVID-19, the best advice is to really have a conversation with your primary care provider. They'll be able to kind of go through your symptoms and decide whether or not you just need treatment or you need to be tested for COVID-19. Okay. The second part of that question, what is a dry cough? So a dry cough is a cough that does not usually produce mucus or phlegm. Some people call it a hacking cough. So that cough that kind of persists with inflammation or infection in the throat, but you're not producing any sort of mucus or phlegm. Again, call your primary care provider to see what are the next steps for you. Question number 5. What do doctors estimate the real number of COVID-19 cases to be, including those that are asymptomatic? And does that number really even matter? Well, according to an article published a few days ago, the CDC has begun preliminary studies to really take a look at this question. They're going to be looking at individuals in hot spots who were not hospitalized to see what some of those antibody rates might be. Currently, they are estimating that nearly 240,000 people in the U.S. Have been infected with the virus, and nearly 5,500 people have died. And I would say that the numbers do matter because they're going to help us to better prepare for future pandemics. So yes, the numbers absolutely do matter. Question number 6. Can drinking hot liquid keep the virus from settling in the lungs? So currently there is no scientific evidence to suggest that drinking hot liquids will prevent the virus from settling in the lungs and causing symptoms. These home remedies might decrease some of your symptoms or might make you feel nice and warm and fuzzy inside, but they should not be seen as a serious medical treatment for a disease. So again, see your doctor if you are really having symptoms. Okay, question number 7, about halfway through here. Should I stay farther away from people who are running or biking outside? Are they expelling droplets farther? So if you're going to venture outside for some much needed sunshine and air, or maybe you have to make a quick errand, it is recommended that you keep 6 feet away from the next individual to help decrease the spread of this virus. Reasonably, theoretically, if people are exerting themselves more, coughing more fiercely or intensely, or breathing harder, there is a potential that maybe that respiratory droplet might travel further. But currently, there's no evidence of that. We do have evidence that being around a lot of people who might be infected with COVID-19 does increase your risk of transmission or getting the disease. So again, we're practicing stay at home, social distancing, good hand washing, all of those things. Question number 8. Can mosquitoes carry COVID-19 to others? Well, we do know that mosquitoes can carry disease, for example, West Nile virus, but currently there is no evidence to support that there is mosquito to human transmission of COVID-19. Okay. Question number 9. Do nasal and saline rinses help kill viruses, or do they at least help you keep from being infected? What about triple antibiotic in the nostrils? So again, currently no evidence to support that regularly rinsing your nasal passages with saline has protected people from getting COVID-19. And unfortunately, antibiotics do not work against viral infections. I'm going to say that again. Antibiotics do not work against viral infections. Question number 10. Should I disinfect the inside of a communal washing machine in an apartment complex before using? So this is an important question because 15% of Americans actually do their laundry in a communal laundry facility or laundromat. So currently the CDC does not have any further recommendations for this aside from washing your clothes according to the manufacturer's instructions, making sure you're using sort of a warm or hot setting for washing your clothes, and drying your clothes completely. I would also recommend that if you have to go into a laundromat or laundry facility, to make sure that you are disinfecting the knobs, the handles, the tables, that you are wearing gloves. Try to go at a time where not many people are in the facility. And also, alternatively, you can consider washing your clothes in the bathtub or the sink and air drying if that's a possibility for you. Question number 11. Is a specific blood type more susceptible to COVID-19? So currently, again, there is no evidence to support that blood type O is less susceptible to COVID-19 than blood type A. There was an incompletely reviewed study out of China not too long ago, but even in that study, it referred to the risk of needing hospitalization, not the risk of contracting the virus that can lead to the disease. So currently, no evidence of that either. Last question. What really has to happen next for us to be able to stop social distancing and staying at home? So again, I say hashtag flatten the curve. It's going to be so important to continue our social distancing efforts, washing our hands frequently, sanitizing those surfaces that are very commonly used in the home and in the workplace, covering our cough and our sneezes. With all of these efforts, we can begin to decrease the transmission, slow the number of hospital admissions, decrease the number of people dying, and hopefully more sooner than later, return to a more recognizable way of life. So let's take some of your questions in the chat box here. I'm going to scroll down. Hello, everyone. Hello. Thank you for joining us. Let's see here. So, Terry, I'm going to say the name here. Terry Ryan asks, I have asthma and allergies, and I am on glucocorticosteroids. How worried should I be? So, steroids can suppress the immune system, but this is for treatment of your allergies and asthma if it is at a severe level. But maybe taking those medications, the benefit of taking those medications outweighs the risk of you not taking those medications. Because we are trying to keep people out of the hospital that don't need to be there. Your risk of contracting COVID-19 in the hospital is definitely more increased as opposed to being on the outside at home. But in terms of your own individual risk, that is something that I would recommend you have a further conversation with your doctor. I have several of my patients asking me about the risk of being on one medication or another. And it really is a specific conversation and an individualized conversation to have with your primary care provider. Okay. So Heidi Moore asks, immediately after recovering, assuming from COVID-19 infection, how likely is it to get re-exposed and sick again? So in terms of COVID-19 immunity, which is what I think the question is kind of getting at, viruses, once you're infected with a virus, and if it's a typical virus, usually your body will kick out antibodies to try to fight future infections. If COVID-19 is similar to previous viruses like SARS or MERS, there has been some immunity shown to reinfection from those viruses. We don't, however, in this case, have really any information about how long that immunity might be. So the jury is still out, and that's something that definitely at the federal and state level, the smart people are going to be taking a look at. But again, wash your hands, cover your cough and sneeze until we get the go-ahead to stop social distancing or stop staying at home orders. We all need to do our part. Okay. I'll do one more question here, one or two maybe. Rhonda Jenkins asks, I have moderate COPD. Should I be worried about going out to it says out to say grocery store? I'm going to assume that means should I be worried about going out to the grocery store? So COPD is one of those lung conditions that can put you in that is putting you in a high risk group for COVID-19 infection. So I would recommend limiting as much as you can going into public places, especially places where you are unable to keep that 6-foot distance because you are at a higher risk of infection. So if you do truly have to go out, make sure you are wearing your cloth mask. Make sure that you are staying 6 feet away from people. Make sure that you're in conversation with your doctor so that you can get a better understanding of what the risks are. But definitely COPD is one of those high risk categories, okay? Okay, one more question. Let's see here. So Carol Alexander asked, I'm having surgery May 13th at Wexner Hospital. How safe am I? So without knowing what kind of surgery it is, it's difficult to really give you advice on this. Currently, all elective surgeries have been put on hold, but I assure you, everyone at The Ohio State University Wexner Medical Center, whether you are coming in to the hospital or a clinic, are doing everything in their power to make sure that the patients who do need to be there are able to get there, and that the risk of transmission while in that setting of COVID-19 is low. But again, I would follow up with your surgeon, see what kind of procedure you're having done. Is it necessary? Can it be put on hold? And take it from there. Well, I'd like to thank you all for joining us today. Our time is up. I just want to let you know that everybody, we are in this together. So please continue with your social distancing efforts. Make sure you're taking time for mental health each day, whether it's stepping outside or calling up a friend or video chatting with someone. Please stay safe and have a good day.